Can you score 40 out of 40? Only smart people get all of them right. What is the normal adult body temperature approximately? Which organ pumps blood around the body? What is the first thing a nurse should do before touching a patient? Which vital sign measures the pressure of blood against artery walls? Which route of medication administration involves injecting directly into a vein? What does CPR stand for? Which blood cells help fight infections? Which blood cells are mainly responsible for carrying oxygen? What is the main function of the kidneys? Which instrument is commonly used to measure blood pressure? A patient suddenly becomes unconscious. What should the nurse assess first? Which position is commonly used to help a patient who is having difficulty breathing? What is hypoglycemia? Which device is used to check blood oxygen saturation? Which vital sign represents the number of breaths taken per minute? Before administering medication, which is most important? Which of the following is a common sign of infection? What should a nurse do after giving an injection? Which organ is primarily responsible for breathing? What is dehydration? Which is the safest way to identify a patient before medication administration? What does IM mean in medication administration? does SC/subcutaneous mean? Which nutrient is especially important for building and repairing body tissues? A patient reports severe chest pain. What should the nurse do? What is the normal resting pulse rate for most adults, approximately? Which condition involves abnormally high blood sugar? Which condition means abnormally low blood pressure? Which condition means high blood pressure? Why is hand hygiene important in nursing? A patient is bleeding heavily. What is an important immediate action? What is the main purpose of gloves during patient care? Which organ produces insulin? Which disease is characterized by difficulty controlling blood glucose levels? What is anemia commonly associated with? Which position is commonly used when performing CPR on an adult? What should a nurse do if they are unsure about a medication order? Which of these is a sign that a patient may be experiencing difficulty breathing? Patient confidentiality means that a nurse should A nurse notices that a patient's condition is suddenly getting worse. What is the best action? Be honest. How many did you get right? Comment your answer below. Let's see who gets 40 out of 40.